Hi, how are you today?
Good, how are you?
I am great. I am April. I'm a nursing student with Harper College. Do you mind if I do a head-to-toe assessment of you today? Okay, great. So a few standard questions that we always like to ask new admittance. Do you know your full name and date of birth?
Yes, Marie Soriano, January 1984.
Okay. Do you know where you're at?
I'm at a hospital in Elk Grove Village.
Okay. And do you know what season it is?
It is springtime.
Springtime. Okay. Springtime in Chicago. You made it. So with a general assessment, I'm assessing her level of consciousness. She is ANO times 3. I'm also assessing her cognitive function. Her behavior is appropriate for the setting. I'm noticing her skin color. I don't see any flushings there, as well as her speech and communication is clear. So we tested your visual acuity before on the Snellen chart, and that's testing cranial nerve number 2. Your vision was normal for both your right and your left eye. And we also tested or calculated your BMI index, your body mass index. Your height was 4'10", your weight 133, so your BMI was 27.8, I believe. And then we also took your vital signs, and everything was within normal limits. We tested your blood pressure, your pulse, your respirations, as well as your temperature orally. So everything was in normal range. Okay, so throughout this system, I'll be breaking everything down by body systems, if you will. And there will be times when I will have to palpate or touch you, and I'll give you a heads up before doing that, okay? So first I want to start with your head. I'm noticing and inspecting the size and shape. It's appropriate for your body. I'm noticing, also inspecting the scalp and noticing that there aren't any lesions or lumps or scabs that I should be aware of. I'm palpating the scalp. Any tenderness when I'm doing this?
No.
Okay. And now I'm noticing also the symmetry of your face with cranial nerve number 7, facial symmetry. I would be looking at her eyebrows, her eyes, nasolabial folds, as well as her nose. Everything is symmetrical. And I'm also palpating your maxillary sinuses. Any tenderness when I'm doing that?
No.
As well as your frontal, any tenderness there?
No.
Okay, I'm also palpating your temporomandibular joint. If you could open and close. One more time. There it is. One more. Open and close. Okay. We got it this time. And also palpating. I'm going to come back to it because it's going to hit me. Palpating here. What is it? We'll move on. We're going to the eyes next. I'm seeing, just inspecting the eyes. First thing we're going to do is perform what we call the 6 cardinal positions of gaze. So just follow my pen here without moving your head. And follow my pen in. Okay, great. And next we're testing, and that's testing cranial nerves numbers 3, 4, and 6. Next we're going to test your pupillary light reflex. So to look straight ahead, I'm just going to shine a light into your eyes. Looking straight ahead, I'm looking for constriction. Yep. And now on the other side. Okay, very good. And we tested accommodation. So at this point, I would say Perla pupils are equal, round, reactive to light. And normally with your pupillary light reflex, with your size of your pupils, we want to see them constrict 2 sizes below what they already normally would be in a dim room, although we know we're accommodating for the lights here. I also want to take a look at your ears. I'm noticing and inspecting the outside condition of the external auditory canal, palpating the pinna here. Any tenderness when I'm doing that? No. Okay, next I would perform the whisper test, which is testing cranial nerve number 8. I'm just going to be off to the side of you and say a phrase or a word. If you could just repeat back what you hear.
Black shoes. Red flower.
Okay, great. And now I would move on to the nose. I'm noticing symmetry within her nose. I'm also seeing that there aren't any skin lesions that I need to be aware of. Any tenderness when I palpate here?
No.
Okay, and now I'd like to test the patency of each nostril. Go ahead and put one finger to close one side. Breathe in. And now the other side. Okay, now we're going to be assessing the mouth and throat area. I am inspecting her lips. I'm not seeing any cracking on the outside. She looks to be hydrated. Go ahead and open your mouth. I'm looking at the gums, her teeth, I'm looking at the buccal mucosa, the hard and soft palate, the top of her tongue. Go ahead and lift your tongue up. Noticing the floor of the mouth as well. Put your tongue down and say ah.
Ah.
Okay, I'm seeing the uvula move as well as noticing the tonsils. And that is cranial nerves numbers 9 and 10. And go ahead and stick your tongue out straight ahead. Okay, very good. I'm making sure that the tongue is going midline, and that is cranial nerve number 12. So now moving on to the neck. I'm inspecting the glands. I'm looking at the parotid glands, the salivary glands, and the thyroid glands that would be here at the base of the neck. I don't see any enlargements there. For range of motion, can you go ahead and put one ear or to the shoulder and then to the other side? Can you look right and left? To your, left, and then you can look right and look up and down. Okay, very good. So good range of motion there. And now I would also test to see and palpate for any lymph nodes that I may feel. So I'm just going to call out areas. First, we will start with the preauricular, the postauricular, the occipital in the back. And now moving on to the submental, the temporomandibular area here, the jugulo-digastric, the superficial cervical, deep cervical chain, the posterior here in the back, if you could turn your head just a little bit, the ponytail. Posterior cervical would be right here, so I'm just going to palpate here. And then can you go ahead and just cave up so I can get inside right here, at the clavicle bone. So this would be the supraclavicular. Okay, very good. Let's see here. Now we're going to move on to your chest, your anterior, as well as your posterior here. So I'm looking at her chest. I'm noticing a normal rate and rhythm, and I'm noticing that she's not using any accessory muscles to help her compensate for breathing. So I would, at this point now, I'm just going to listen to your lungs. And I would just call out inhale and exhale. Gotta have them in first. Inhale and exhale at different spots. Normally we would just instruct the patients to breathe out of their mouth a little bit deeper than normal. So first starting at the trachea. Oops. Before moving on to that, I just want to make sure that we palpated the carotid areas on one side each. And then I would listen with the bell of my stethoscope to the carotid arteries, one on each side. Okay. So now moving on to your respiratory system, the lungs. So it's going to be 9 spots, and I'm just going to say inhale and exhale to abbreviate. So breathe out through your mouth a little bit deeper than you normally would. So inhale, exhale, 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 inhale, exhale. And then for your right side, if you could turn a little bit towards the camera, we're just going to listen to the right lateral lobe, which has 3 spots. So all the way up here. Okay, very good. Inhale, exhale, inhale, exhale, inhale, exhale. And then we'll get the left side, left lateral lobe, which has 2 spots. So inhale, exhale, inhale, exhale. And then if you could just swivel back around, we'll go ahead and get her back area. This has 9 spots. So this would be, inhale, exhale, inhale, exhale, and we're going to avoid the scapulas here. Go around it. Inhale, exhale, 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 that's 5. Inhale, exhale, inhale, that's 6, 7. Inhale, exhale. Inhale, exhale. Moving on to 8. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay, you can turn back around. And before getting back on the chair, still sorry. sorry. We're going to check, go ahead and lay down. We're going to check for jugular vein distension. The head of the bed would be elevated at 30 degrees. Go ahead and turn your head to the right. So I'm assessing to make sure that there isn't any jugular vein distension. Turn your head to the left. No distension there. Okay, great. You can come back up. So now I'm just going to listen in several places with the diaphragm of my stethoscope, and I will call out the areas that I'll be listening to for the heart valves. So first we go aortic, pulmonic, tricuspid, and then mitral. And then I would listen also with the bell of my stethoscope. Aortic, pulmonic, tricuspid, and mitral. And then I would also listen at the part of the apical pulse for a full minute and note the rate and rhythm there. So this will be the apical pulse, down, over. I listen for 1 full minute. Okay, I'm noticing a normal heart rate and rhythm as well for your heart. Okay, so we're going to now do the upper extremities. I am looking at your skin. I'm not noticing any lesions on the skin. I'm feeling for the temperature. I'm palpating that, which is normal. I am assessing for the profile sign of each nail. And I'm also testing capillary refill, which we want to be less than 3 seconds on each side. Profile sign on each nail bed, and assessing for the capillary refill. And I'm feeling for her radial pulses on each side. Okay, very good. Now we're just going to test your range of motions with your hands. So go ahead and flip your hands out for me and then turn them over. And we'll go ahead and assess your range of motion within your elbows. Go ahead and give me a bicep curl here and let down. And for your range of motion for your shoulders, go ahead and reach up and form a prayer sign in the back, and then all the way down, just fan out and turn up to a prayer sign in the back. Very good. Range of motion for shoulders. Okay, now we'll test the strength. So give my hands a big squeeze. Very good. Push against my hands. Okay, let's test the strength of your elbows. Give me a bicep curl. I'm just going to pull on here and don't lose form. As well as here as well. Okay, hold your arms straight out for 10 seconds. 1, 5, and 10. I'm just going to pull down. Don't let me push too hard. Yep, good resistance there. Okay, and also to test cranial nerve number 11, I'm just going to push down on the shoulders. If you could shrug up. Very good. And as you're turning, don't turn yet. I'm just going to have my hand across on your face. I'm going to apply some pressure. I want you to push against it. Go ahead and turn there. And with the other side. Again, testing cranial nerve number 11. Very good. Okay, so we've covered extremities, we've done the heart and lungs, and now let's move on to assessing your abdominal area, okay? So if you could lay down on the couch. I'm going to move this up. Okay, so first thing, and if you could roll up your shirt just to your bra line, that'll work just fine. Okay, so first thing I'm noticing is the symmetry of her stomach. It's round. I'm noticing the contour, is round, and looking at the symmetry as well. And I'm inspecting the umbilical area, noticing no skin lesions or anything that I should be aware of here. So now before moving forward, I would want to assess and listen to each quadrant of her stomach, each 4 quadrants, and assess for bowel activity with the bell of my stethoscope, or the diaphragm, in each quadrant. So listening for, she's hungry. So now bowel sound here. Okay. So now moving on with the bell of my stethoscope, I will listen to the aortic artery, 2 inches above the umbilicus. And then also the renal arteries, just a little bit off to the side of the aortic artery here. Okay, and now we're going to move on to what palpation. And I'm first going to do just a light palpation to make sure there aren't any enlarged organs, and then I'll follow it with a deeper palpation, okay? So any tenderness here, 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 here. Okay, now I'm going to go a little bit deeper to assess a little bit further. So it just would be all quadrants, especially every area. Deep here. Oops. Sorry. Okay. All right. Very good. And with that, we'll move on to the lower extremities. Okay, so I'm noticing her skin here. I am not seeing any skin lesions that I should be aware of. I'm noticing the temperature of your lower extremities is normal. I'm looking at her toes, and I'm assessing for the capillary refill in each nail bed. I'm feeling for the dorsal medius pulse. And I'm looking for pretibial edema, which I don't see as I'm palpating. Go ahead and push down on the gas and pull back towards your nose. Okay, testing strength of the feet. And now I'd like to test your range of motion with your hips. So go ahead and bend your leg up and then fan your leg out. Very good. And fan in as turn the hip in. Very good. And you can put this leg down. Go ahead and bend your leg up and then bend out and then turn in and pull out. Very good. Make sure this doesn't go to sleep. Now let's test the strength of your hips. Go ahead and push your leg out and try to pull in, pull out, and push in. Very good. And let's see, we've got the hips, the legs. Okay, and if you could hold up one leg 5 seconds off the bed or the couch, 1, 2, 3, 4, 5. And now moving on to this leg, 1, 2, 3, 4, 5. Okay, very good. I'll do the Babinski test. So I'm just going to apply some moderate pressure towards the lateral side, inside of the foot, and across the foot as well, okay? So here, and then this side as well. Okay. Okay, so that was the Babinski test. Okay, you can go ahead and sit up because we're going to have to test the strength of your knees. So go ahead and sit here. Up close and personal again. Did it freeze? There we go. Okay, so I'm just going to, your feet are dangling here on the stool, so I'm just going to test the strength of your knees and apply some pressure here at the lower part of the leg. So go ahead and pull back and push away and pull and push. Okay, very good. Also, now moving on to the, well, first I want you to point your foot. Can you see it? Okay, and then flex, dorsiflex. So we had the plantar flexion and the dorsiflexion, okay? Now let's move on to the neurological exam. So with that, I'm going to apply a sensation. It's just going to be what feels like a cotton ball. Your eyes are going to be shut, and I want you to tell me every time that you feel it and just say the words now, okay?
No, 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 no.
Okay. And the next test, I would just assess for, to make sure that they can feel the sensation of something dull and sharp. So just to give you a precursor, I'm going to use your hand. This is what you'll feel when it's dull. This is what you'll feel when it's sharp. Okay. And your eyes have to be shut.
Dull, 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 sharp, sharp, dull, dull, sharp, sharp, dull, sharp, sharp, dull, sharp.
Okay.
Sharp, dull, dull, dull.
Okay. And let's see, we did that. Next thing is testing your quadricep tendons as well as your bicep tendons. So if you could hold your arm out. Oops, we're going to have to improvise again. I have a pillow here. And I just want you to relax your arm. So I'm just going to hit it lightly with my stethoscope here. Go ahead and make a fist. Okay, go ahead and relax your hand. Okay, and now we'll do the other side as well. Make a fist, like a bicep fist. Okay, go ahead and relax your arm. Okay, and now we'll move on to your quadricep tendon, not bicep. Okay, so looking for a light little tip here. Okay, so feeling for the patella. Oh my God, you weren't kidding. Mine don't move. Okay, cool. It worked. Okay, so we did that. Now I'd like to have you stand up. And I'm performing the Romberg test. So I would just, let's have you back up a little bit. I got the camera really close. Okay, so you would be away from the couch and have your eyes closed. And the person would stand here for 20 seconds, assessing their balance here. Okay, and if you could, just going to hold the camera up. If you could just walk to the dining table, like a normal walk. And then as you're coming back, just do a heel to, you can turn back towards me and do heel to toe. Heel to toe. Heel to toe. Mm-hmm. Okay, very good. And real quick, if you could sit back down again on the stool. Should be a little bit more clear. And also want to make sure if you can rub your heel alongside your shin on each leg. Very good. Okay. So now, also I want to make sure do the testing of the rapid finger movement. So what I'm going to do is have you touch your toes, and then you're going to touch my finger, and I'm going to be moving my finger. Did I say toes? Okay, no, sorry. So touch your nose, and then touch my finger, and I'm going to be moving it. Yep. Well, you have to go back, so connect the dots. Okay, keep going. One more. Boom. Okay. All right, so stand up for me one more time. Okay, and now I'm just assessing, you can turn to the side. I'm assessing her spinal curvature. I'm noticing a nice curvature in the thoracic cave as well as the lumbar convex here, a little bit of a dip. And I'm noticing that her height is straight and she's standing at ease. Go ahead and touch your toes. Very good. I'm noticing the nice curvature of her back in the thoracic cave, a nice C. Okay, you can stand back up. All right, and that concludes our physical head-to-toe assessment.